my name is Marc Doré, and I'm a fifth-year anesthesia resident. As an anesthesia resident, I get to spend countless hours here in the simulation center. We get to practice basic skills like putting intravenous's in, intubating patients, central lines, or placing epidurals. But what we gain the most out of the simulation center is how to face complex situations and crisis situations, and how to learn how to do crisis resource management. Similarly to a pilot who's flying a plane, they might do simulation and learn how to handle a plane going down towards the ground. When we come to the simulation center, we're confronted with crisis situations which we might encounter rarely in real practice, but we learn to deal with these situations so that when we face them in real life, we know how to react to them. The simulation center gives us the chance of doing this without harming patients, so that when we face those situations in real life, hopefully we'll have learned how to deal with them and can deal with them appropriately and hopefully save the patient's life. Simulation is very important because it allows us to practice our skills and face certain rare situations without putting patients' lives at risk. A lot of what we do here in simulation can be brought back to real life when we transition to practice with real patients. I myself have encountered a few scenarios here in the simulation center, and when I've gone back to real practice, I've actually used the skills that I've learned here in the simulation center, and I think I've actually brought some benefit to real patients in the hospital. One of the advantages we have here at the simulation center is the advantage of having full body mannequins. These aren't just your typical mannequins. These are as close to real life patients as you can have. These patients, or these mannequins, have a pulse, they breathe, they can talk to you, their skin changes color if their oxygen is low or if they're having a rash. You're able to do a physical exam on them and listen to their hearts and their lungs. So they're really as close as we can get to a real life patient, allow us to practice our skills without bringing any harm to patients.